Welcome, everyone. Thank you for joining us to another NetHope Solutions Center webinar. And today we are addressing disability in digital tech response to COVID-19. We're welcoming today presenters from GSMA, Leonard Chesser, and Stanford Edge. Before we get started with our session, I'd like to go over a few housekeeping guidelines for the audience today. We'd like you to keep this an interactive session. Please post any of your questions or comments in the chat window, and we will have a Q&A discussion toward the end of the hour today. Also, please look for a follow-up email later today or early tomorrow with a link to the recording for this session and any collateral and links to other information that's pertinent to the topic. Also, we would really appreciate your feedback about this session. Your feedback is very important to making sessions in the future quality sessions, and we hope that you will take a moment to complete our webinar satisfaction poll after the webinar today. And with that, I will hand it off to Sonia Rutzel from Catholic Relief Services to kick off our presentation.
Thank you very much, Madeline, and thank you very much, NetHope, for facilitating this webinar with us. Today we address a very important topic about accessibility and disability inclusion in digital technology, and we have a very diverse speaker panel for you sharing their insights. So may I introduce you to our speakers. We have Olusola Owonikoko. He's the project director of Project Enable Africa and the executive director of Stanford Edge, based in Nigeria. Evelyn Mintange. She's the project coordinator for strengthening curriculum access and assessive technologies at Leonard Cheshire, based in Kenya. And with her working is Pauline Okach. She's a teacher at Ninsari Primary School in Migori County, Kenya. And we also have Clara Arandajan joining us. She's the Insight Manager for MOA for Development as GSMA. So thank you all very much for agreeing to share your insights with us. And without further ado, I will already pass on to our first speaker. We will have 3 short presentations for you and then plenty of time for question and answers. So to the audience, if you do have any specific questions to the speakers, please place them in the chat. And if you like to already address it to a specific speaker or any questions for the panel at large. Thank you so much. And this is my moment to hand over to Olusola to talk about what does accessibility for ICT mean for people with disabilities in Africa.
Thank you so much. Thank you for having me today. My name is Olusola Owonikoko. I am going to be talking about what accessibility or accessible ICT means for persons with disabilities in Nigeria. So this is a research work that I want to talk about, and it came as a result of over 6 years of work in the disability with the disability community in Nigeria, of promoting digital inclusion. And at some point, we wanted to know what exactly ICT access meant for persons with disabilities. So that was why we did this study, and I'm just going to share the overall results of what we found out in this study. Next slide, please. Yes, so we came out with these 7A models, which has guided the work we do. Next slide, please. Which has guided the work we do at Project Enable Africa, an organization that promotes digital inclusion and advocates for disability, rights, and inclusion in Nigeria. So like I mentioned, it was down to understanding what exactly access to ICT meant for persons with disabilities. Of course, we found a few framework around, but they were not comprehensive enough because we really needed to understand what access is. And this was to also help us guide the work we do in helping people, especially those who are further marginalized. We know the community of persons with disabilities are mostly marginalized, but then we also know there are some people who are further marginalized, especially those who might be in rural area, hard to reach or far to reach communities, or some particular groups within the community of persons with disabilities who are further marginalized, like those who are, with who are blind, deaf, or those with learning disabilities, and so on and so forth. And this model represents our discovery, which has become the lens through which we review our programs. The first one, I'll just quickly talk about them in the few minutes I have, why I share an example of how we have applied this to the COVID situation, especially in the last year. We found out from feedback, and this was a research that interviewed a number of persons with disabilities, collected qualitative data and analyzed. And I think the first point that came out strong was the availability of those assistive technology. And, for many of our friends that were not in Nigeria or in the developed countries, they might know, or they might have many of these assistive technology or things that help them access technology, or the technology themselves available. But for many persons with disabilities in Nigeria and across many developing country contexts or underdeveloped country contexts, they are simply not available. And at that point, they are fully marginalized and are not able to even go on to the next spectrum in the definition of accessibility. The next component in accessibility, as we found out, is affordability. Of course, we know that poverty and disability is closely linked, especially in countries where there is really no social welfare or provisions for persons with disabilities. This can be a major issue. So it's not just about being available, then we talk about, is it affordable? Because if it's not affordable, then it might just be as good as not being available. And then, of course, awareness is a very important theme that came out strong in the data we collected. It might be available, maybe even affordable, but a lot of people might just not be aware of the availability of such technology or assistive technology, or even how to go about them. And then ability is the next theme that came out strong, how to use those, tools that are available. And this is the area we work at Project Enable, my organization, where we train people with disabilities how to use some of these assistive technology and to have access, digital inclusion as a whole. Ability is very important. Who is able or unable to use assistive technology, and that would define if such technology is accessible or not accessible. And the next thing is adaptability. We found out that for so many, assistive technology, for example, screen readers and some of these tools, they might be available, they might be affordable, people might know about them, but are they adaptable to the language, to the local context of the people that want to use it? Some people might even be able to speak English, and so that they can use some of these tools, but the accent of some of those tools or some of those resources, and I'm using screen reader as an example, might just not be what people who might be able to speak English in rural area, what they're able to use, because of lack of adaptability, to the context, either to the language or to the environment, or even maybe just access to power, or energy sources to power such tools and devices. So these first 5 components are more technocentric in terms of their, they are more about the technology. But at the end of the day, part of the things conclusion, or part of the recommendation of the research, is that technology should not just be about technology. It should be about people, because technology in itself should be tools, not the end. And that is what, that is why we went further to check the human-centric definition of some of these tools. And the first the first one in that component of access is attitude, the attitude of the people who might have all of these 5 initial A's in place, but might not have the right attitude, or the attitude of the environment or the society towards them. And lastly is the agency, the power of people to come together to make things happen for them. And we think that is very important, because we have leverage on that power of agency to make accessible technology available and affordable, or maybe even promote ability for persons with disabilities. Next slide, please. So I haven't talked about those 7 A's. I'm just going to talk about how we adapted, or how we changed some of our programs to be able to reach many more people last year. When COVID happened, it was difficult to continue some of our programs, because most of them have been physical, especially when it comes to training. We've had people come to our hub and do the training, but it was a lot difficult because we couldn't go out. And part of what we have engaged in is, number one, the use of simple online tech platforms. So we've been able to get a lot done from basic WhatsApp groups and making trainings and information available from WhatsApp group. And from those WhatsApp group, we have leveraged on the power of agency, bringing persons with disabilities together in a community and letting them drive their own need, their own learning. And that has been quite effective for us because we are making use of basic everyday WhatsApp that can be used on a little beyond basic phones, really, because those with really, really basic phones or where there are no phones, they are still not able to access that. But leveraging on WhatsApp, we've been able to reach a wider audience. And secondly is offline tech platform. Of course, part of what we had to go through was redefine what technology is, to understand that technology can be very basic and appropriating technology is very important, which means understanding the level of technology available at those community and leveraging using that, level of technology. And that is why we have gone towards offline tech platforms. So what we are actively working towards now is creating some of our training content in simple devices like a memory stick that can be accessible on phones. Because part of the challenge we realized was the lack of access to data in terms of network data. People might have phones, might have basic phones or access to some of this technology, but do not have access to network where they can access lots of materials. So with simple tools like a memory stick that can be sent to villages that people can have, or people without phones or technology can use on their TV. Most TVs these days come with USB drive. They are able to access learning content and still able to learn and position themselves for and be able to join the train of digital inclusion. So that is coming on well, and it has proven to be able to help us reach even a larger size or number of people, especially those that would otherwise not be able to reach. And the last strategy we have put in place is the use of community-based groups that are able to organize, again, still leveraging on the power of agency of people, the capacity of people to come together and make learning happen for themselves. They are also able to address beyond the technological end of things to addressing the attitude, the human side of access to things. And this way, we are able to also engage a lot more people, community leaders, community gatekeepers, caregivers, parents of persons with disabilities in small groups where we provide overall training, because some of those people tend to have access to the technology, that we are developing, and then they can now take the learning down to back to those who may not have access or who may not be plugged to those technologies. So those are the ways that, especially since last year at Project Enable Africa, we have engaged to be able to reach those we were not able to reach as a result of COVID not allowing us to go out and implement our programs in the usual way. And of course, all of this is built around our definition and understanding of what access is as a result of the research that we carried out earlier. Thank you so much. I'll be happy to take questions.
Thank you so much, Olushula, for kicking us off and the great overview. Next up, we will hear about a specific program using digital innovations to support children with disabilities in Kenya. So I'll hand over to Evelyn from Leonard Cheshire and her colleague Pauline Okash, who's a teacher in the program.
Hello, everyone. Thank you for having me here today. My name is Evelyn Mtange. I work for Leonard Cheshire, an organization that focuses on reducing barriers to independent living, learning, and working that people with disability face around the world. So today I'm going to focus on the Girls Education Challenge Transit project that is being implemented in Kenya, that has implemented the Orbit Reader project for learners with severe visual impairment. So while the COVID-19 pandemic affected schools around the world, teachers were not going to school, children were not able to go to school too. Leonard Cheshire managed to conduct an online training. Next slide, please. An online training for teachers on the Orbit Reader. The Orbit Reader 20 is a refreshable braille device meant for supporting learners who are visually impaired. With technical support from Ikitabu, the GCT project trained 10 teachers who are now working with 11 learners in various primary school and secondary schools in Nyanza region in Kenya, now that all the learners are back in school. The training covered 5 modules through online platforms, including WhatsApp and Google Meet. Because of the pandemic, there was no interaction. So the teachers could share the experiences through WhatsApp, and then the follow-up meetings were done through Google Meet. Then follow-ups were conducted in late 2020 and early 21 to ensure the skills were enhanced for all teachers, and learners who are visually impaired were linked to the trained teachers so that they could support them in class and in catching up with the rest of the learners. Next slide, please. Some of the key successes from the online training that was conducted by the project for the teachers with learners, for the teachers who are being trained on the Obit Reader and Braille, where learners have been using the Obit Reader since schools opened to learn the letters of the alphabet in Braille and make simple sentences in eBraille. They can also use it to type and delete notes, helping them engage with various learning materials. There is also an adapted timetable developed by the trained teachers in schools that ensures learners get the learning support they need, with extra time during lessons to help them use the Obit Reader, because the Obit Reader is not part of the curriculum that is being delivered by the government. The introduction of assistive technology has helped improve inclusion in the schools and change the attitudes of other students towards learners with visual impairment. The Obit Readers have also greatly improved the learning progress. Learners can now read and write without straining their eyes, allowing them to improve in accessing learning content in class and stay on the same level as their classmates. Without assistive devices like the Obit Readers and access to Braille materials, children with severe visual impairments will not have the same learning opportunities and may even feel discouraged to attend school due to lack of access of adapted learning content. The Obit Readers help in compressing the huge Braille volumes into multiple tiny accessible content that can be stored and accessed in a memory stick at any one time. Next slide, please. So during the teacher training, definitely like in any other project, there were challenges, and some of the challenges faced during the teacher training, it was realized that not many teachers are trained in Braille in mainstream schools. So it becomes hard for learners who are joining school to be supported and to feel accommodated in those schools. Then skills acquisition for both Braille and use of the new technology was at different levels, and hence the need for individualized interventions for the teachers. When during the training, the teachers could not really get, were not at the same level. So we had to make follow-up calls to the teachers to know where they are at and then support them at an individual level. Access to diverse eBraille content is limited and in some cases also expensive, and quite expensive for the beneficiaries without project support. The Obit Reader is not a gadget that can be easily afforded by all learners, especially in developing countries like Kenya. So it can be challenging for all learners with visual impairment to have it. There is a need for remedial extra time for learners to adapt this new skill. As I said, the curriculum does not include that in the timetable, so the teachers have to create time so that they can impact these skills and knowledge to the learners. Then there is a constant need for capacity building, follow-up and support from a technical Braille and tech expert to the teachers that may not be readily available, especially in the rural location where the project is based. So after that, I think with me, I have Pauline Okach, a teacher who is also supporting one of the learners. This is one of the teachers that was trained by the project. She can now give us some of her experiences while training this learner and also during the training. Thank you. Pauline? Pauline?
Pauline, you might be on mute.
Pauline, I think you're on mute.
Okay. Hello? Hello.
Hello, we can hear you, Pauline.
All right. Thank you very much, Mtange and all the panelists. I just want to express or just say a bit of my experience with the child. Actually, I was trained on how to use Orbit Reader, and in our school, we practice inclusion. So we are having diversities or different domains in our school. And so specifically for this one of the visual impaired, we got an Orbit Reader, which I actually used to train the girl who is visually impaired in our school. As she has stated there, the curriculum does not allow maybe teaching a different thing at a time, but we actually set time, that is, I've adjusted the timetable to accommodate this girl. So right now she's able to type letters of alphabet, like she's able to associate that the dots are 6, and actually in the Orbit Reader, they are 8. So the 8 dots, she's able to identify that dot 1 is letter A, like that. Dot 1, letter A, dot 1, 2 is letter B, dot 1, 4 is letter C, up to letter Z. She's able to do that. She's also able to actually type simple words, like the words that can take 3-letter words, maybe cat, dog, because the girl is still young. She's able to do that effectively. She can also delete certain words that are not properly written. If she confuses, she's able to delete. So actually, because it's a process, she's actually taking her time to learn. And actually, it has improved her writing because she was really straining. She could not because of a cornea problem. So actually, I would say that the challenge that we have is that most of the teachers in our school do not know how to use this machine. So I am the one trying even to induct them so that at least they can also try, so that when I'm not even there in the school, the girl can continue learning. Otherwise, Leonard Cheshire has really worked hard to ensure that all these things work well to the benefit of the special need in our school. Thank you.
Thank you very much, Pauline and Evelyn. Thank you for your insights, and also thank you to our attendees for posting your questions. Please keep those coming. But before we go to questions, it's my pleasure to introduce you to Clara from GSMA, and she will be talking about leveraging the potential of mobile technology for people with disabilities. So Clara, the stage is yours.
Thanks for the introduction, Sonia. So I understand that the attendees in this webinar they come from all over the world. So let me tell you good evening, good afternoon, and good morning today. My name is Clara Aranda, and I work as an Insights Manager for the GSMA as part of our Assistive Tech program. Next, please. Next again, please. If you're not familiar with us, I'll give you a very quick introduction. So the GSMA is a trade association that represents mobile network operators globally, and we have more than 750 operator members and nearly 400 member companies from the wider mobile ecosystem. We are known for our industry leading events, such as the Mobile World Congress, and we also have led industry initiatives such as the commitment to the Sustainable Development Goals. I work for the Assistive Tech program, which is part of Mobile for Development. Our work is funded by the UK government through FCDO, and our aim is to drive the greater inclusion of persons with disabilities and maximize the potential for social and economic inclusion. Next, please. So in our program, we look at disability from the perspective of the social model. So this means that to us, disability is the result of barriers that exist in society that are external to an individual. So examples are, for instance, social attitudes, stigma, the way in which infrastructure is designed, and also systemic barriers, such as the way in which we design institutions and our interactions with different processes and systems. Now, from this perspective, we can understand, or we can see the concept of assistive technologies, which are products and systems that help maintain or improve an individual's functioning and independence. And in that way, they promote their well-being. But the problem is that assistive technologies are not always available in many parts of the world. They are traditionally provided through systems such as the ones used for medical devices, the supply of medical devices, and they tend to be very complex supply systems that tend to have a lot of inefficiencies. So this means that many people don't have access to assistive technologies. And what we believe is that in these places where assistive technologies are really hard to, or where some people are really hard to reach through assistive technologies, we believe that mobile phones can play a really significant role. And this is because mobile phones, and in particular smartphones, they have embedded accessibility features that help persons with disabilities to access many different services and access information. But there is not a lot of research being done in this field, but at the GSMA, we have started to conduct some of this research and generate some evidence on the role that mobile plays in the lives of persons with disabilities. Next, please. So the Assistive Tech program has been really highly led by insights. This means that we have generated evidence and data in many different countries, low and middle income countries, particularly on what we call the digital inclusion gap. So we look at digital inclusion from the perspective of the mobile internet user journey, which has 4 different stages. So we look at mobile ownership, awareness of mobile internet adoption, and also we look at different mobile use cases or use cases of mobile internet, to be specific. So in our data, we have been able to generate enough evidence to say that a mobile disability gap exists throughout the user journey. This means that persons with disabilities are less likely to be mobile owners, but also they are less likely to be users of mobile internet and perceive the benefits of mobile and mobile internet. In particularly, we have been able to generate evidence of the intersection of gender and disability, for instance, and our evidence tells us that women with disabilities are particularly at risk of being digitally excluded. Can we move to the next slide, please? Now, as we see, there are gaps. We know that there are gaps in mobile ownership and mobile internet use and adoption, but we have also seen that there is a great potential of around digital technologies and mobile technologies to become assistive technologies themselves. So last year we conducted a landscape study to try to identify digital assistive technologies innovations that are emerging from low and middle income countries. So we identified a total of 93 digital IT innovations emerging from Africa, Asia, and the MENA region. A large proportion of those that we identify came from South and Southeast Asia. And we were able to identify some hotspots such as India, Kenya, Egypt, and South Africa, where we see that there is a lot of activity in this innovation sector in digital ITs. Next, please. So in that landscape, our purpose was to look at digital in general, so different types of technologies, but we actually found that the majority of them, around 80% of them, are digital innovations that are either mobile-based or mobile-enabled solutions. This means that many solutions in the digital assistive tech space are either mobile-based platforms, they are apps, or they are devices connected to a mobile phone, or built-in accessibility features. Next, please. Just to give you an example, one of the case studies that we looked at was Kibo, which is a solution designed by a startup called Trestle Labs in India. So Trestle Labs developed a solution to help people with visual impairment to listen to text in ebooks and also to be able to scan documents and convert them into digital text. The name of the solution, their initial solution was Kibo XS, and it was almost like a scanner of documents that would digitize them and convert them into a digital file, which they could upload to the website and then listen to the text through the website. But then they realized that quite a few of their users were smartphone owners. So they decided to develop the Kibo app, which now uses the smartphone camera to capture and scan documents and then digitize them. And then people now can listen to the text using the app. The app is free to be downloaded by the users through the app stores that we all know in our phones. And to us, this is a really interesting example of solutions that are being generated by startups locally in low and middle income countries. The reason why this is important is because we have heard in the previous talks some of the challenges that may exist around the contextualization of technologies. So this is an interesting case. Next, please. We found that the majority of innovations are being designed in two main areas. One of them is community and independent living, solutions that can support an individual's limitation in an activity, for instance. But there are also many solutions emerging in the education and vocational training type of solutions. But we also found that there are many opportunities in other areas. So we saw examples of innovations emerging, for instance, in financial services, but also in healthcare, employment, citizen participation, and many other areas. So there is an opportunity that through the evolution of digital, we will be able to see more and more innovations emerging in many different areas of an individual lives. Next, please. We found that in these sectors, so innovations for digital assistive tech, startups are particularly strong. They are really the ones that are driving innovations in this area. We identify more than 40% of the solutions are being designed by startups, but there's also a role that NGOs and smaller enterprises are playing with, they develop around a quarter of the rest of the solutions each. So it's really interesting to see for us how the sector looks like in terms of innovations and who's driving them and who's being very, very active in this sector. Next, please. Finally, as the GSMA, we do believe that our work as in insights, the evidence that we generate is really valuable, and our engagement with different stakeholders, it's also really, really valuable. But we also believe that a global effort is needed to be able to create a shift in how persons with disabilities are reached and are included through and by digital technologies. So for that reason, last year we launched the principles for the digital inclusion of persons with disabilities. We developed these principles together with mobile operators and also different disability organizations and experts. And our principles are focused on three different elements. The first one is that if we want to drive the digital inclusion of persons with disabilities, we need to start from the inside of the organization, changing the processes inside of the organization. So we need to embrace disability inclusion at every level of the organization. Then we need to understand how we can reach and better serve persons with disabilities. How do we design products and services that are valuable and are relevant for them? And the third point is that we need to deliver inclusive products and services that meet the diverse requirements of persons with disabilities. So just merely designing and developing the products is not enough. We need to make sure that we know or we develop the mechanisms to make sure that they can reach the people that actually requires these services and these products. So as the GSMA, we will continue to generate work so that we're able to support these principles. So for instance, we are conducting research on how to better co-create solutions, digital solutions with persons with disabilities. And we will also continue to generate insights on the mobile disability gap and the actions that are required to close that gap. Next, please. Finally, I just want to thank again the FCDO for the fundings that they provide to our work. And if you have any questions, please just drop them in the chat and I will be happy to answer them. Thank you.
Thank you very much, Clara. And thank you for all the panelists for your contributions. So we have a number of questions, and first I'd like to ask some specific questions around the technologies you've mentioned that help support people with disabilities. So first we have a question for Urushula. You mentioned using memory sticks, and so there was a question in the chat if you could please elaborate a little bit more how the memory sticks work.
All right, thank you for the question. So like I mentioned, Project Enable is focused on training persons with disabilities, equipping them with ICT skills such that they can, go on to use those skills to apply them for work and all. So since we are not able to meet people to train them, we have put the contents in memory sticks. That's what we're working on, to put the content in memory sticks in inclusive formats. Initially they used to be online, YouTube and all, but then we realized that data network, access to network will be a barrier. But putting it on memory sticks that are usable on the computer or television or on the phone, such that, there's memory sticks that can go into the USB ports of the phone. And now they are able to watch them on their phone without need for downloading anything. And then they have them to go back to. And as such, it also supports the work of the community-based groups, such that the leader of the community or the small group in the community can leverage on the content to, play and explain and, use to train many people within their community. I hope that answers the question.
Excellent, thank you. My next question is for Evelyn and maybe Pauline. So the question here is in the chat that there's more interest to learn about the issues of screen reading software not be able to pronounce local languages. Is this something you have experienced, or have you tried to advocate for the creation of speech synthesized capable of pronouncing underrepresented languages? Maybe you'd like to comment a little bit about that.
So about that, for the Orbit Reader project, this is when we are just introducing it to the learners. So for now, the learners are still learning the basics, that is the Braille alphabets, as I said in my presentation. So I think that is something to consider too.
Olushula, is that something you have also experienced, particularly issues around technology and different local languages or accents?
Yes, I think it's a major barrier. So we have an example of persons with disabilities who are going to take exams, the secondary school leaving examination, and they were to work with screen readers, but they couldn't understand, what the screen reader was saying now because of the, English accent, even though they also speak English. So, but investing in that would, creating sign language, screen readers that transcribe in local language will require significant investment. We have not been able to do much around that, other than, trying to connect with organizations that produce this to consider also making them in local language. And that might be an interesting area for an organization like GSMA to look at least major local languages in countries like Nigeria and other countries might be helpful. Thank you.
Thank you. Clara, do you work with different private sector organizations, or do you have more insights on working around voice content, or particularly with regards to translation or local languages?
So I'm going to answer this in parts. So in our research, we have definitely found that voice recognition or voice command technologies are quite challenging because of contextual or language differences. So a lot of these technologies have been designed for, I would say, the global north. So generally the most spoken languages, and in particularly English. So even if locally some people speak in English, they have an accent, just like I have an accent, and sometimes the technologies are not good enough to be able to recognize what people are saying. We have seen in our work that there are few organizations that are trying to tackle that by designing or developing solutions at the local level. So we have seen it, for instance, in Bangladesh. I'm aware of a startup that is designing a technology for people with visual impairment that is around the local language, is around Bangla. So we have seen them. We don't necessarily work with this type of private sector ourselves, but what the second point that I was going to make is that we recently launched, now we're in the assessment process, but we launched an innovation fund. And through our innovation fund, we are trying to support some digital assistive technologies. I cannot say for sure which ones will be funded in the end, but it's likely that some of them may or may not be related to this challenge. But we do try to support the development of local innovations, and at the moment, with the Assistive Tech Innovation Fund, we will be able to support some digital assistive technologies emerging from low and middle income markets. I hope I addressed the question.
Thank you so much. And I also seen a comment from Viamo, who are using local actors for voice content. And we can also link that we had various Viamo speakers at previous ICT4D webinars explaining a little bit more about their services. But that I'd like to also speak a little bit more with our panel about the strategy. The challenges or strategy of engaging small community groups. So Olushula, you mentioned that earlier in your presentation, wanted to see if you like to highlight a little bit more what's your sort of lessons learned or some good practice with wider engaging community groups, and then also the same for the other speakers if you want to chip in afterwards.
All right, thank you so much for the question. So engaging local community groups was something we are also still learning and experimenting and, going through the process. So the major scope is to call for volunteers, and that was how we did it, call for volunteers. One thing we have learned to do was not just to restrict it to persons with disabilities. When we started, it was just going to be persons with disabilities who are volunteers because we want to be very inclusive, but we have also seen a few people without disabilities who have been very passionate and helpful in driving, especially people who work directly with persons with disabilities, like caregivers, like teachers, and like parents. And so what happens is within a community, they are able to come together as necessary. Of course, it's easier for smaller groups to come together within a community because of the COVID protocol, but the Nigeria COVID protocol is not that stiff. It's just difficult to travel around. So with that, we are able to have them on a training platform like the WhatsApp we mentioned. So the first step was to train those people who are volunteered, who are part of it. And then from the content we have created, get those across to them, so that they themselves can learn first and practice, and then they are able to pass on the learnings to the small groups they have. And like I said, it's something we are still on the process trying to learn from and, do as much as possible to improve on. But one thing that is clear is local community groups have a lot of opportunity to help themselves learn, and that's the power of agency. And the other side to it is it doesn't have to just be persons with disabilities who are leading this, even though the active participation of persons with disabilities is important, but sometimes it's about those who are available, those who have some level of understanding, especially in terms of education, who are able to translate some of what we have in English language to local language and get the learning continue. Thank you.
Thank you. Evelyn or Pauline, would you also like to talk a little bit more about your co-design of with local communities and with your students and teachers?
Thank you very much for that. So for now, with the OB treaters, the teachers are the only people who have been trained to support these learners at school level. And then with time, the teachers can also support these learners in their home environment so that they can be able to relate well. Remember, some of the parents to these learners do not know much about the OB treater. So the teachers, through interacting both with the learner and the parent, will be able to assist the parents at the community level and the learners in school through home visits over the weekends and when the schools are closed.
Thank you. And Clara, would you like to add anything, particularly since you earlier mentioned the principles for, or the three core principles for embracing disability inclusion?
So I think one of the points that I was mentioning is the work that we're currently doing. So we are trying to find different methods or different approaches that can be used for co-designing digital solutions with persons with disabilities. It's been a challenge with the current scenario, of course, because I guess engaging with local communities and participation always requires to be with people, and it requires these kind of physical interactions, which become quite challenging with with the current pandemic. But we are hoping that we will be, we have some really good learnings from this whole process, and we are hoping, as I was saying, a lot of our work is to support the implementation of these principles. So we're hoping to be able to develop some sort of tools or some sort of toolkit that we will be able to use with different organizations that are interested in working in this area. It will take some time still. Like I wouldn't say that it will come in the next month or so, but it will take a little bit of time still for us to develop these. We're still learning ourselves, I guess. I would say that we are no experts in this field. We're learning how best to do this work, but we are a very driven group of people. And like I said, our aim is to increase the digital, or drive the greater inclusion of persons with disabilities through digital. So we will continue to generate and share our insights in that space.
Thank you. Yes, it's still a very young topic area with increasing focus for sure. And definitely during the pandemic and the increased use of digital technology is so much more important. So that's why I want to talk with you also a little bit about how COVID has impacted your project. So particularly maybe Evelyn or Pauline, if you'd like to also explain a little bit how the pandemic has changed, particularly with the schools being closed. How did this project or application support learners, especially in local community when there is a limited connectivity? Do you have any lessons here that you would like to share?
Yeah. Okay, this is what I would say. When it comes to pandemic, it was a real challenge because we could not meet the children very well, but the schools opened in phases. That is, we had only 2 classes attending. And so I had to make a program with actually the child whom I was interacting with. I had to make a program to meet the child amidst the time that the others were learning. It was a real challenge because you have to get a space for the child and then teach the child and ensure that the child is safe. But nevertheless, the others also embraced it and ensured that the learning is not interfered with, even though it was a little bit difficult because When the child misses, you have to call the parent so that the parent can ensure that the child comes in school. And when the child goes back home, you have to ensure again that the child is safe, because it was a little bit traumatizing, and people were fearing that they would get some problems. So actually it affected because of time and timetabling, but that is why we had to adjust the timetable so that it could fit the child with visual impairments learning. Maybe Evelyn can add something.
I think you've summarized it all, Pauline. Thank you.
Right.
And Clara, one question was also talking about assistive technology in the developed countries. Maybe you'd like to mention a little bit what changes you've seen, particularly here now due to the pandemic. You know, when I first approached you to talk about this topic, we came from a sort of slightly different angle, and we're also looking at technologies being used. I mean, you're also based in the UK as I am. Used in our countries, for example, for people with autism, or maybe alternatively looking at emerging technologies.
So I think, where can I start? So a lot of our work focuses on low and middle income countries. So of course, the landscape study that we did was focused specifically in the African and Asian regions, and MENA region as well, of course. But we saw through that research, but also through the field work that we've conducted particularly in Kenya, Bangladesh, now in Ghana and in Sri Lanka, that people do use some technologies that have emerged from high-income markets. So some examples of the kind of the usual suspects are, for instance, Be My Eyes or Seeing AI, developed by Microsoft, that one in particular. But there are some challenges. So Seeing AI, for instance, only works in a couple of platforms, so not everyone has access to that type of technologies. Be My Eyes also has some limitations. We have seen that at least in the interviews that we've conducted, even the levels of awareness of people, of knowing that the technology exists and knowing how to use it, requires a level of skills and digital literacy that not everyone has. So we do see some, I would say, contextual transfer of technologies coming from high-income markets to low and middle-income markets, but there are always some challenges. The other is that I didn't mention the numbers, but I mentioned that we see a gap in mobile ownership, which is large, but when we look at smartphone ownership specifically, we see gaps that are larger than 50%. So that means that in every country where we collected data, people with disabilities are 50% less likely to own a smartphone than non-disabled persons. So there's still a lot of work to be done in terms of access to the devices themselves and access to the solutions that people can use through a smartphone, for instance.
Thank you, Clara. And Olushula, would you like to also share how your lessons learned from the COVID pandemic and what you're seeing sort of as the next steps for Project Enable Africa?
All right, thank you. The interesting thing is when the COVID started, our core programs were not the focus of the program. It was more of a humanitarian approach because most of the people we served needed relief materials. So the first 3 months during COVID was focused on providing relief materials rather than training. But what that also helped us understand was the fact that we have to always be in touch with the people we serve so we can know what their needs are. And from that, the approach, the relief materials we distributed, we actually started a new project which is around supporting persons with disabilities, with providing business support for persons with disabilities. Because working with persons with disabilities in the interior and rural areas to provide relief materials for them help us realize that there were many persons with disabilities who run very small micro businesses. And we felt strengthening that would be very helpful in helping them raise revenue, income, to support themselves and their loved ones, and then they are better positioned to be trained. And that has proven to be a little bit more effective in our approach in providing trainings, ICT, access to ICT trainings for persons with disabilities. For the community-based programs and training, we are also really scaling on that right now. As a matter of fact, right now we are making calls for more volunteers across the country so that we can replicate that particular implementation of community-based training using non-network or data-dependent, technology to get training materials and content across to them. So we are scaling that, and we are also measuring and reporting. So our next plan, like I mentioned, is scaling that across so that we can reach many more people. Because again, we don't want only those in the cities where our office are to be the one who have access to this training. There are many more people in those rural areas. And interestingly, access to job has also improved as a result of that, because last year alone, we recorded significant, a little bit more of connecting persons with disabilities to job opportunities, because there are many persons with disabilities who are not in central cities, who now have access to some of these skills, who can work remotely, who have acquired a little bit of more skills, and they are able to plug into the value chain. And that as a whole is affecting how our work is. Now we are focusing on, strengthening the supply and demand of talent with disabilities as against just training. And of course, also doing a lot of work with helping employers position to have persons with disabilities work with them remotely, and getting the requirements of employers so that we can put that into the content that we train them with. Of course, our content are really accessible. We try to include sign language interpretation, transcription, and the community-based leaders are also able to help ensure that the content is consumable by those we intend them to be used by. Thank you.
Thank you. As always, the capacity building and the people are first, and the technology is something which is hardly ever in the center. But I just still, because this is an event where we're talking about technology, just as a final comment, Clara, would you like to share a few words how do you see the potential of emerging technologies to support persons with disability to bridge the gap?
Yeah, thank you. I think so from the data that we collected as part of the innovation landscape, like I said, we see that mobile still has a really strong role to play in, I don't know if you would call it the future of digital ATs, but we have seen some really, really interesting examples of what I would call, for instance, connected devices. Probably you could call it the Internet of Things. So assistive technologies such as, the white cane or other types of technologies that are connected to mobile and are able to provide more integral solutions or different diverse services connected in ones. So I guess that is a really interesting opportunity. Access to data is quite a big challenge in general in disability-related research, but even more in technology and digital assistive tech related research. So I think as we generate more data in general, and as more organizations and companies adopt, for instance, the Washington Group questions, we would be able to use the power of AI or machine learning to be able to provide better digital services for persons with disabilities. But we need to change the way in which we're collecting data for that and ensure that the algorithms are inclusive as well. So I think those are interesting areas that we need to see how they evolved. They are emerging. We have started to see some innovations in this space. So we just need to see how they move forward.
Thank you so much. That is a fantastic closing remark to our webinar. And we're already at the end of our time. So thank you so much, Olushula, Evelyn, Pauline, and Clara for your insights and for everybody attending. Before you leave, please do give us your feedback in the webinar survey. And also, I wanted to highlight that our next ICT4D conference podcast will be featuring interviews about digital diversity, equity, and inclusion. And as always, I'm always interested in hearing from experts about interesting innovations or trends. So if you would like to recommend a speaker, please get in touch with me directly. And otherwise, thank you so much for joining us today and enjoy the rest of your day.
Thank you, Sonia, and thank you to all of our attendees today. Please do take a moment to complete our webinar satisfaction poll. The link should be in the chat window, but a window will pop up after you close out the Zoom session. And do look also for the follow-up email, which will include a link to this recording and all the collateral, so you don't need to worry about copying and pasting email addresses, and other links. We'll provide those to you. And I am Madeline No with NetHope, and we hope that you have a great rest of your day. Thank you for attending.